Hi everyone, and welcome to the Chrissy B Show, the program that loves to look after your mental health and well-being. Now let me ask you a question. Are you always cold? No matter how warm it is, indoors or out, you just can't help shake that cold feeling off. Maybe your hands and feet get so chilly at night that you have to sleep with socks and gloves. If this sounds like you, then you may be experiencing Raynaud syndrome. Raynaud is a circulatory condition that affects around 20% of the adult population worldwide. We're going to be featuring Sue Farrington from Scleroderma and Raynaud's UK, since it's coming up to Raynaud's Awareness Week. We'll also be showing you our emotional visit to Southampton with Colin Sutherland of Wings of Freedom. Wings of Freedom uses birds of prey to give therapy to those suffering from mental and physical difficulties, and the presence of the birds helps to alleviate some of their symptoms and give them some pleasure. We'll be seeing their amazing work a little later on. Along with that, Dr Rob Hicks will be answering your medical questions, and Feyi Jegede will be showing us some super workouts now that we're way into the new year and many of you out there are trying to live up to those resolutions. But first up, check out this video from our iridologist Raynaud Simpson as he gives us some great nutritional tips from the heart of sunny Australia.
Good evening everyone, this is Raynaud Simpson. I've been a nutritionist for over 55 years and analysed eyes for over 42 years. I'm in sunny Noosa, one of the sunniest parts in the world, 28 degrees in Queensland, Australia. And I'm going to give you $1 million secret. One of the secrets of living a long life is to drink 3 litres of water every single day with 80% water and 20% juice. What that does, when you drink water like that, 80% water, 20% juice, is when you drink the water at that level with that sort of mixture, it will go mouth, stomach, cells, kidneys, bladder, out. What that means is that the 3 litres of water will hydrate the 75 trillion cells in your body. What that does, when your cells are hydrated on a daily basis with 3 litres of this mixture, it means your skin will be in fantastic condition. I'm 71 and my skin is that of a 50-year-old. All right, the second secret I'll give you for now is that when you eat, you must balance your breakfast, your lunch and your dinner with 80% alkaline foods and 20% acid foods. When you eat alkaline, it's vegetables, fruits and herbs, that's alkaline. 80% of your food should be alkaline for breakfast, lunch and dinner, and 20% of your food should be acidic. Acidic is sardines, meat, fish, venison and so on. So you must balance your food. Every time you have a meal, breakfast, lunch or dinner, you must have 80% alkaline of your foods and 20% acidic. If you do that, you balance 80 and 20, and then you have water 80-20 as well, 80% water, 20% juice, what you will find, you will have the perfect balance. You won't get sick. Now, the last time I saw a medical doctor because of this system I created was 1967. Only because I got shrapnel in my face and pains in my leg. That's all. So, but follow the advice and you will live a long, abundant life. Thank you.
Thank you very much to Raynaud. Now, have you been overindulging and need a bit of help with your workouts? Well, here's the lovely Feyi Jegede.
I did say to you guys, it's a total body workout, so let's get going. We're going to run around the chair, okay? So I want you to lift up your feet as you're doing so. Right, the reason why we're doing the running is to keep our heart rate up and your metabolism stoked. Just one more second round. Whew, keep going. Excellent, oh, good. Now we're going to work our upper body. So we're going to work our arms, the back of our arms, which is our triceps, and our lower back as well, or upper back actually, upper back. Right, sit down for me. Excellent. And get your breath back. Have your feet hip width apart. And now we're going to work our bust area and, as I said, the upper back. So get your hands up, L-shaped arms, clasp them together. So your elbows and your forearms and your fingers all together. Whew. And what we're going to do is push it up into the sky. Are we ready? Let's go. Push up, And breathe if you need to as well. Don't hold your breath. Oh my goodness, these are killers. They look very, very easy. And to be honest, they're very simple exercises, but each and every one of them is effective. So try and do it slowly and don't rush it too much with the momentum. Keep going. Good. 4, make sure to relax the shoulders, don't hunch it too much. 3, 2, and 1. Excellent, wonderful. Okay, let's walk the feet a little bit forward because we're going to do some more of the arms and we're going to do the tricep. That's the flabby area, the bingo wings that most of us don't like, okay? So make sure you've got a good grasp of that chair. Come a few inches forward. Now, this is how you know if you're in the right position. When you bend, your elbow and your arms should be at that 90-degree angle, and then you push up. Straighten those arms, okay? Straighten, and then we go down. Right, have you got that? Let's go. And push up and down. Wow, goodness me. Let's see how many we can do of this before we tire out. Whew. Give me, should we do another 4? Good. 3, good. 2, 1. Make sure you're breathing. Excellent. Oh, there you have it, guys. That was your total body workout using just that one equipment, the chair. And now you can just sit in this chair comfortably and just relax. Thank you so much for joining me in today's fitness segment. Take care and I'll catch up with you again soon. Bye-bye.
Thank you very much to Feyi. Now, just before we go to our break, let's take a look at this video from the Mental Health channel about how expressing yourself can do wonders for your mental health.
As an actor, you have to be able to make the words on the page come alive. So you got to be able to tap into it. You got to be able to catch those emotions, and you have to be able to feel that energy. And you know, we want to try to have some fun because the whole thing is to express yourself. Class, how are we? We all good? Come on, let's see some big old smiles now, come on. Because this whole program, this whole thing, this workshop today is about self-expression. And so what better way to find out what's going on inside your head as an actor than to challenge you to write down your own individual monologue about an incident that's happened in your life. And in order to express yourself, you gotta be able to just let yourself go. Let yourself go. Being able to be free enough within your soul to allow your feelings to flow. Can't do anything but help your overall mental health. Being an old Army guy, you never asked your soldier to do anything that you wouldn't do yourself. So I'm gonna go back and do a monologue on my toughest hour. Tough love. Shake it out, shake it out, shake it out, shake it, shake it, shake it, shake it, shake it, shake it, shake it. Let them lips get loose, too. So let's do some tongue twisters. Peter Piper picked a peck of pickled peppers. If Peter Piper picked a peck of pickled peppers, whatever happened to the peck of pickled peppers Peter Piper picked? Acting allowed me to release a lot of that pent-up tension that I brought back from Vietnam with me, and it allowed me to create different people within my head.
How do we get it? What are we gonna do? Which one of these buttons? Which one? Oh! Which one of these buttons?
It's key that we be able to communicate. It's key to be healthy. It's key for your mental state. Because if you're not getting it out, where's it going?
Expression, expression, expression gets bigger and bigger. Where do we go from here? How do we express ourselves? Action. What the hell? What's going on? Hey, call somebody. Let's call somebody. Hey, 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 is anybody out there? The thing for me is the release. I mean, if I have pent-up anger or pent-up grief or anything like that, if I can talk about it and express it and get it out, then that'll help me heal. Be able to use things from the past to help mold ourselves and be able to reach back and grab those things and develop them into characters. And that allows us to use a little of that pressure release every time, every time. And eventually you'll get to the point where you can handle it without breaking down and crying. You can remember those things that hurt. And I too wrote a monologue about a painful time in my life. How can you look at your wife knowing that the whole makeup of her was to be fruitful and multiply? And now that was gone. Gone. And then she discovered the contents in the bar from a beautiful spirit. She went to where she could take a fifth of vodka. The hardest thing in my life was to go to AA meetings, trying not to enable her to continue. Hurdles, hard times, to hold her in your arms and just see her go from 185 pounds to 132. She died March 9th, 2013. Sometimes you think she's free, but then you know, I still got the shackles. I still have the pain. I still have what if. What more could I have done? What if? That's a monologue, y'all. That's a monologue, okay? Monologues, the story, you have to be able to identify with it, right? You got to be able to identify with where you are, and you got to be able to, where are the emotions? Where are the emotions? That's what acting is. Express yourself. What we supposed to be doing? All right, if we express ourselves and free our mind, then what? There you go, that's what we're talking about. Come on down, Lee, you next.
Thanks very much to the Mental Health Channel for that video, and if you'd like to know more about them, then do head over to our website, chrissybshow.tv, and click on our contributor section to find out more. Now don't go away, because after the break we'll be featuring Sue Farrington from Raynaud's charity, SRUK. Rob Hicks will be answering your medical questions and much more. But first, what percent of the world's population suffers from Raynaud's? Is it A, 5%, B, 20%, or C, 50%? Find out the answer after this break. Welcome back to the Chrissy B Show, everyone. So we hope you enjoyed Ronald Delari Simpson's tips all the way from Queensland, Australia, and that you've taken on board Feyi Jegede's fitness tips. And now, since it's Raynaud's Awareness Week, we're going to feature the Raynaud's Foundation about the disorder and what's been done to raise awareness. But first, before the break, I asked you what percent of the world's population is thought to suffer from Raynaud's. Is it A, 5%, B, 20%, or C, 50%? Well, I can tell you that the answer is B, 20%. Women are thought to be up to 9 times more likely to suffer from the disease. And despite being discovered over 100 years ago, the causes for Raynaud's are still unknown. We're here to hopefully shed some light on what this is and what's been done to combat it is the Raynaud Foundation.
So Raynaud's is a condition where the body overreacts to changes in temperature. It can also be affected by stress and anxiety. And what happens is that the flow of blood to the extremities becomes restricted. So it affects mainly the hands and the feet, but it can also affect nose, ears, tongue even. And what you will notice if you have Raynaud's is that your fingers become white, a kind of waxy look. And that's because the flow of blood has become restricted. Once the blood circulation comes back, you will start to see a change in colour. Now that doesn't sound very much, but if you can imagine when your fingers go white, they are numb. You've got absolutely no feeling in your fingers. It means that everyday tasks like buttoning up a coat or getting your money out of your purse becomes incredibly difficult. And then when the blood flow starts to come back, the pain is intense. They throb, you get pins and needles. So for some people, it is really excruciatingly painful. And probably one of the best ways I could describe it for people who don't have Raynaud's is imagine if you plunged your hand into an icy pond and left it there for a few minutes. You would feel pretty cold and your hand would be really numb. Then you go and put that hand on a radiator, and can you imagine that intense burning heat? And that's what it's like for some people, up to 20 times a day if they get a Raynaud's attack. And sometimes it's the most simple of things that can bring on a Raynaud's attack for somebody, like opening your fridge freezer or being in a supermarket down the kind of cold aisle. It can bring on that what's called a Raynaud's attack, where people start to see that discoloration in their fingers and their fingers go numb. I think the thing to say is that for many, it's quite mild and it's manageable. But for some people, it can be more severe, where the number of attacks are far greater and the severity and extent of those attacks goes on for much longer. And for some, it's really impacted on their ability to do their jobs and ability just to carry on a normal life. And yet many people have just been told just to get on with it. So it's a condition that is often dismissed by the health professionals. It's interesting because it's a tale of two extremes. Raynaud's is a very common condition, whereas scleroderma is particularly rare. So if I put that into kind of number terms, Raynaud's affects 1 in 6 people in this UK. So it's as common as hay fever, but actually very few people have heard about it. So that's probably about 10 million people may be affected by Raynaud's, whereas scleroderma is a more rare condition. The reason those two conditions are together is that Raynaud's is often the first presenting symptom for something that is slightly more serious. But I would want to say to the viewers, don't be alarmed, because 12,000 is a very small percentage of 10 million, but that's the reason that both of those conditions are within the same charity. In March 2016, scleroderma and Raynaud's was established, but actually we've got a really rich heritage because we created out of the merger of two organisations, the Scleroderma Society and Raynaud's and Scleroderma Association. Both had been going for 30 years and actually both had been providing a very similar service. So I think the trustees of the two organisations thought it makes more sense for us to come together so that we don't duplicate our offer and that people aren't confused about where they go for support. I think one of the main things that we do actually, and one of the most important things for us, is to appear on shows like this. The media has a huge part to play in helping us get the message out to a far wider audience. Yes, we've got a great website with fantastic information on it, but unless people know it's there, they're not going to come and visit us. So I think the work that we do with the media, be it TV, press or radio, is really, really important. I think there's another thing equally, and that's our community and them telling their stories. I think their stories are really powerful because it's first-hand experience and they can really explain what it's like for them living every day with the condition. In the summer last year, we had our first ever mobile clinic. And people will be very familiar to see kind of diabetes testing and having your heart tested. But this was the first clinic where there was a free test available for people to tell you whether you had Raynaud's and also whether you perhaps were showing signs of severe Raynaud's. When we went, we had no idea really how many people would attend. We thought maybe 10 a day. We were there for 7 days and we had over 650 people attend the clinic. And of those 650, 95% were given a diagnosis of Raynaud's. It was important for raising awareness, but also that data was contributing to a piece of medical research so that we can have better data about the numbers of people that are affected. And it was really good to reach out to Leeds, where we estimate probably around 75,000 people are affected by Raynaud's. And some people had no idea that they had Raynaud's. They saw our posters showing, you know, the white fingers or the bluey purple fingers, and they came in. And then that means they're better prepared to deal with it and to manage their condition.
Thank you so much for that, guys. And now let's head over to Anna Kennedy's Hillingdon Manors School, where some groundbreaking therapy utilising iPads and even Lego is being used to aid children with autism.
My name's Anna Kennedy. We're at Hillingdon Manors School. We're actually at the primary school today, and it's the school that I set up in 1999 because of my two sons, Patrick and Angelo, being diagnosed with autism spectrum condition. Today we're here because we're going to be talking about Lego therapy and the use of an iPad. I wish the Lego therapy was available when my boys were very young because it's an amazing therapy. At the school, we don't just use one therapy. There are many schools that just follow one particular therapy, but we actually use an eclectic approach here. So we have our own speech and language therapists, we have our own occupational therapists, psychologists, we have drama therapy, music therapy, and it's because all of the children are so different from each other. It's not one size fits all.
Yeah, good day.
Today we've been looking at Ava using the iPad to communicate. She uses an app called ProLoquo to go on an iPad and was facilitated by Fernando, her teaching assistant, in having her snack. So we saw Ava using the iPad to understand what was happening and help her communicate her wants and needs for her snack time.
We come here to the hall and we show her the iPad. What do you want to eat? She needs to point for us what she wants to eat. You need to use your iPad. Show me your iPad.
I want juice.
Please. Depending on her mood, she's going to be more engaged or not. So we need to teach her how to use it. And it's what we are doing since 2 years ago.
So Ava has a diagnosis of autistic spectrum disorder, so communication is challenging for Ava. She is non-verbal. In that case, we look to alternative means to communicate. That's called alternative augmentative communication, or AAC for short. The iPad that Ava was using is a type of AAC.
Classroom.
Yes.
Lunch. Snack. Classroom lunch.
Yes.
So using her face, gestures, pointing and using the iPad to communicate when speech is not her primary mode, so she has to use other modes to get her message across.
How many do you want?
She might say lunchtime, but that might mean she's actually asking when is lunchtime. And she uses it in the classroom, and she uses it at home as well. So her family have been instrumental in helping generalise some sort of the specific teaching skills that we use with her in the classroom and in therapy sessions. She does like to sort of throw objects, and I think it's that visual aspect of kind of throwing it and looking at it fall that she finds that quite stimulating visually. But I guess seeing her looking at the iPad, using the app to listening to us and watching us point to pictures on there, and then for her to be able to actually use it independently has been a really satisfying journey so far.
And she got really motivated to using it. She improved a lot in behavior, because now she is able to communicate what she wants and what she needs. That makes really easy, because she was really frustrated before. She's not anymore.
I want juice.
More use.
We just wanted to give you a little snippet of how Lego therapy is very useful and how it's improving communication with a lot of the children at the school.
Reason for doing the Lego therapy is mainly to develop social communication skills. We're also developing other skills like problem solving, creativity. So I think Thomas has really improved in his ability to work within a group. He may have shied away from that a couple of years ago.
Thomas, you're going to be? Supplier. What does the supplier do in Lego therapy? Listens to the engineer.
He's just really grown in confidence. It's also been useful for him to develop his expressive language skills and learning how to talk and interact with his peers. For Danny, Danny's has developed a lot of patience. Lego is a big interest of his, and he can get very excited about it. So I think he's learned how to kind of control some of his reaction sometimes, or kind of need to help others. He knows that when it's somebody else's turn, he needs to wait and let them have a turn.
Is that you?
Yep,
and what's
I am the engineer, and I tell everyone what to do.
On top like this?
It's not that one. It's the two-stud sand-coloured piece.
They might not be used to working together in a team. They might just be used to kind of playing by themselves and building their own thing. They can get quite possessive about toys. They can be inflexible about maybe taking on a new role. So they are challenges that come up every time we start off this process with a group of children. We're always kind of looking to new research and looking at what's out there. Lego therapy itself in this format is a relatively new tool, and it's something that we do use regularly for the children here at Hillingdon Manor School.
So I'm very proud of this school, very proud of the children here today that have been filmed.
I did get a great sense of satisfaction and joy in watching them develop, because sometimes they start off kind of being really shy, not even having that much language, not kind of understanding how to work together as a team. So when you start that as your baseline, and you go through the sessions weekly with them, and you see them learn and develop and become more creative, more accepting of rules, more cooperative within their play, it's just really satisfying to see, and yeah, a joy to witness.
Using the power of Chrissy B, that other families can see, I would like to try that for my child. I'm going to speak to my school and see if they can implement what's going on here, so they can show them the clip and see how the children have progressed.
Thank Thank you so much to Anna Kennedy and everyone over at Hillingdon Manors School. Well, don't go away, because after the break we'll be seeing some more brilliant therapy, this time from some of the birds of prey over at Wings of Freedom. Alongside that, I'll be giving you some tips on how to help family members suffering from mental illness. Plus, Dr Rob Hicks will be on the show to answer your medical questions, such as this one. Why would one's sternum hurt? I'm a 19-year-old guy and it hurts to take deep breaths. Find out what Rob has to say after this break. Hi, I'm Chrissy B and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel, Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show and on our Facebook page, The Chrissy B Show. Hi everyone and welcome back to the Chrissy B Show. So we hope you've enjoyed our efforts to raise awareness for Raynaud's. I'll look at the cutting edge therapy being done with autistic children at Hillingdon Manors School and Ronald Delari Simpson's dietary tips all the way from Queensland, Australia. But now let's head over to Dr Rob Hicks to answer some of your medical questions. And if you have a question for him, all you need to do is email doctor@chrissybshow.tv. Welcome to the show, Rob.
Hi, Chris. How are you doing?
I'm good. How are you?
Very well, thank you. Very well.
Let's set up for our questions today.
Eager to go.
Yes. Okay, so let's get straight to it. First question, why would one's sternum hurt? I'm a 19-year-old guy and it hurts to take deep breaths. I've been reading online and I think it's my sternum that aches, but I have no idea why. I haven't done anything to bruise it. Could I be sick in some way that's causing this?
Lots of different reasons for this. You know, the sternum, it's the breastbone.
Yeah.
Here, and often the problem is a muscular injury, which somebody's just not aware that it's happened. So it might have happened 24 or 48 hours beforehand. There are other reasons why you might be getting pain here, even though you could have fractured a bone. So that's something to bear in mind, even though you may not be aware of an injury. It may be something that you were larking around with some friends or some mates and you didn't think you'd hurt yourself, but you could well have either pulled the muscle, one of the many muscles in the chest, or indeed suffered a fracture. There are some medical conditions, so any lung problems like bronchitis, pneumonia, pleurisy, for example, can cause pain, particularly when you, as you say, when you're breathing in. And sometimes if the lining around the heart, the pericardium becomes inflamed, then that can have the same sort of pain in the centre of the chest as well. But with those lung conditions and heart conditions, often usually there are other symptoms. You might feel, a flu-like illness. You might have a fever, you might feel shortness of breath. But I would urge you to get this checked out if it's not getting better, or indeed if painkillers are not keeping the pain under control for you. But if you develop other symptoms like shortness of breath, or the pain becomes very severe, don't hesitate to go and get an urgent medical opinion.
Okay, great. Next one. Can heat rash be mistaken for an STD? Over the weekend, I noticed a small rash around my groin. My boyfriend and I are sexually monogamous, so it doesn't seem like it could be an STD. I am prone to heat rashes, though. How can I tell the difference between a heat rash and an STD?
That's a really good question. And this is, I'm really pleased that our viewer has asked the question, because this is what would sometimes term an embarrassing question that people will just sort of hold in, and of course then things get worse and worse and worse. Lots of different reasons for what this rash might be. I mean, it could be a fungal infection, it could be eczema, it could be a shaving rash, or a result of waxing or shaving, or it could be because clothing's been irritating the groin area. If the clothing's made of synthetic fibres and it's tight, then it can rub and cause this sort of symptom. As far as sexually transmitted infections are concerned, the sort of symptoms that are more likely are pain when you pee, pain when you have sex, discharge, sores, blisters, those sorts of things. And to be honest, groin rashes are not typical of a sexually transmitted infection. Generally, it's the other symptoms that indicate a sexually transmitted infection. But what I would say to you is the most likely cause down there is a fungal infection, which is easily treated. But the first thing to do, obviously, is get the diagnosis confirmed, and that means a trip along to see your doctor for them to examine you and then give you the best advice.
Okay, next question, Rob. Why do my feet and hands sweat constantly? I am a 24-year-old female. All my life I have dealt with severe perspiration of my hands and feet. This happens throughout the day and appears to perspire more when I'm nervous meeting people on an interview, etc. Or when people touch my hands or feet, it seems as if it signals my hands and feet to immediately start to sweat. I hate shaking people's hands and going on interviews because it's like I just put lotion on my hands. It also carries odour on my feet. During summer months, my hands and feet tend to get red splotches and itch. Can you help me?
Yes, we can. And one of the challenges with this condition, excess sweating, it's called hyperhidrosis, is its medical name, is that it's not just the physical symptoms that somebody has to suffer with. Like the knock-on effect is the emotional side of this, is people start avoiding social interaction, they become isolated, they become depressed as a consequence. There's lots that can be done to help you overcome this problem. And you've already identified one of your triggers, and that's you're in anxious and stress-provoking situations, and it's realistic that if you go through some cognitive behavioural therapy, for example, to help you deal with that anxiety, and indeed if you find ways to manage your stress, then your excess sweating will get much less, and that will build your confidence, and the knock-on effect is a positive move forward. The other things to think about is obviously to make sure that you're washing your hands and your feet regularly. With regards to footwear, natural fibres for shoes, cotton socks or cotton tights, for example, because they help the feet breathe more easily. A deodorant is a very good idea, as I'm sure you're using. But the other thing that your doctor may suggest is that they refer you for certain treatments. So one is called iontophoresis, where essentially you have balls of water that minor electric currents are passed through, and you put your hands and your feet into those, and for some reason that helps reduce the amount of sweating. And in fact, Botox injections can be used for people who've got long-term severe sweating as well. But I think the key thing for you is to identify any other triggers. So for some people it's alcohol and caffeine, or spicy foods that trigger sweating, but to work on the triggers you've already identified, which is the anxiety and the stress-provoking situations. Ask your doctor for a referral to a good therapist, and I think that will help you a huge amount.
Okay, next question, Rob. Are X-rays dangerous for older people? My mother is 63 and needs to get X-rays done.
That's a very good question. The simple answer to that is that actually the amount of radiation in X-rays is minimal. So they pose minimal risk. And the other thing to think about is that whenever a doctor suggests an X-ray, it's done with the belief that the benefit of that in diagnosis outweigh any of the risks. The other interesting thing, particularly about your scenario, is that the risk is less as we get older, because the concern with radiation and X-rays is that it damages our DNA, and that damaged DNA may give an increased potential for cancer to develop. So actually, as we get older, the risk from X-rays becomes less. But the bottom line is, if your mum needs an X-ray, it's a good thing that she has it.
Okay. Next question, Rob. Is my eye twitch something serious? My left eye likes to twitch for no reason I can figure out. What is wrong with it? Is this the sign that I have some kind of an eye disease, and is it the first symptom?
This is such a common problem. And it's great that one of our viewers has sent in the question, because I think there'll be many more people who will benefit, hopefully, from the answer. The reality with this is usually the eyelid twitching, and it's related to stress and fatigue in the vast majority of cases. And when you find that actually you're busy doing something and you're relaxed, you'll find it doesn't happen. It's only when you start worrying about something or you're really, really tired that this thing happens. And so make sure you got lots of rest, manage your stress, keep it under control. This problem should go away. If it's persisting and it's causing you lots of problems, then yes, have a checkup with your doctor. The other thing to think about, obviously, is if you've got other additional symptoms, so blurred vision, pain, discharge from the eye, redness, then yeah, you need to get it checked out. But this is invariably a tiredness, stress-related problem, and once you conquer those two things, the problem disappears.
Okay, wonderful. Next question. Can surgery fix my child's ear deformity? My child was born with his ears sticking out and I want to get it fixed.
The answer is yes, it can. It's called bat ears because they stick out. And although the hearing will be fine, kids get teased.
Yes.
And that's where the problem lies. Here in the UK on the NHS, it's rarely done unless the problem is causing psychological issues. So the answer is yes. It's a straightforward surgical procedure where, if necessary, some of the cartilage in the ears is removed, or sometimes you just score the cartilage and then sew it into the position that's required. So the answer is yes. And if it's causing your child a lot of psychological distress, then obviously it's reason to consider having it done.
Okay. We've got time for a couple more, Rob. Is there a way to remove brown spots from one's face? My doctor said that they were what people call liver spots, which I feel I'm too young to have as I'm only in my 30s. She wasn't very forthcoming about the best way, if there is any, to get rid of them or at least diminish them.
Yeah, they're age spots, and the reason they come, the majority of people are over the age of 50 when they get these, but you can be any age, and it's dependent on sun exposure.
Oh. Okay.
Yeah, so they're a consequence of sun damage to the skin where the skin hasn't been protected. There's a whole list of things that can be done to improve their appearance. You can get bleaching creams that can be used over a number of months that will make them fade. Laser treatment can be used. There are processes called dermabrasion, which uses a fast rotating brush to get rid of the cells, the skin cells that these blemishes are made up of. There's microdermabrasion, which is a sort of more gentle version of the other one. And there's also chemical peels where an acid is put on the skin and that gets rid of them. These are all considered cosmetic procedures, so here in the UK they won't be available on the NHS. There are some treatments and creams and lotions that you can buy over the counter, again to help them fade. The simplest solution to these, use makeup to cover them up so that you're not seeing them and nobody else is seeing them. The other thing to do is, no matter what you do, whether you have them treated or not, make sure you protect your skin with a good UV sunscreen, because otherwise they're going to get worse and new ones are going to appear.
Okay, brilliant advice. And last question for today, Rob. The toenails on both of my big toes tend to curl down into the toe. If I forget to cut them and let them grow for too long, they can get extremely painful. Why is this happening?
Ingrowing toenails. Yes. Why is it happening? Well, for some people, the toenails do curve into the skin. What happens then? What happens? You get a break in the skin that allows bacteria to get in, that allows infection to occur. The toe gets red and swollen and painful, and it really can be very, very painful. So the thing to do, obviously, keep the feet clean. When you're cutting your toenails, cut them straight across. Don't go digging into the corners. The other thing you can do is gently, with a cotton bud or a little bit of clean cotton, just put that underneath the toenail just to lift it away from the skin. Wear shoes that aren't cramping the toenails, not pushing the toenails in. Sometimes it becomes necessary for a doctor to prescribe antibiotics or to perform a small surgical procedure where you're taking away some or all of the nail. But generally speaking, if you do take those measures, you should be able to manage the nails so you don't get as far as needing any surgery.
Brilliant, Rob. Thank you so much, and that's all we've got time for.
Pleasure as always.
And if you have a question for Rob, don't forget you can email doctor@chrissybshow.tv. Now don't go away, guys, because after the break we'll be seeing our trip to Thornhill Care Home with Wings of Freedom, and I'll be giving you guys out there some tips on how to show support for family members going through mental health struggles. Welcome back to the Chrissy B Show, everyone. So we hope we've been able to raise some awareness for you about the complex disease that is Raynaud's. And if you'd like to join in with Raynaud's Awareness Week, then please get in touch with SRUK on 0207 000 1925. Now let's head over to Thorngate Care Home and see some of the amazing work being done by Colin Sutherland.
Don't touch them.
Okay, right.
No, because this is a young one. You've missed the others.
Oh, have I? You've already put them back
I've
in
got
the,
one
back
more to
in
get
the
out.
vehicle, have you? Oh, right, okay.
No, there's two in there. If you want to see
okay.
them.
Yeah, well, yeah. Useful, isn't it? Very.
Can anyone guess what this bird done last year? Last spring? When I ever got toenails in baby chicks, I used to put them in with him, and he used to cuddle them. And a peculiar eagle. He's kindly, he's gentle. Watch this. There we are. I've trained each of them birds individual so they retain their temperaments, but at the same time are not dramatic. Therefore, people feel they're linked to the process, and it's the way I do it. That's all it is. It's a simple process. Don't complicate things, because if you complicate things, it won't work. Are we okay? That's okay, Margaret.
There we are, look.
Come on, kiddo.
Hello.
There we go. Oh, it's a beauty.
You lovely creature.
It's a delight. Delight. She's got to get used to seeing everyone. It's familiarisation, and it's just dead simple. The average age is about 24 to 30, but it's like anything. If we have dogs, some dogs get older than they're supposed to be. My mate's got a goshawk. It's only supposed to live till it's 12. It's 28 years old. I've got an eagle owl which is 60. And you see, when I was a kid, my grandfather would say to me, oh, well, I would say to him, what's this dip for? He'd say, oh, that's for putting your nose in. See, what he meant was, it's an interactive process, a bit like shaking your hand, a greeting. I'm just trying to help somebody who's less fortunate than myself. You don't do charity, or you don't do good work to get a medal, do you? You do it because you're doing it. I'm not looking for an MBA. If I wanted an MBA, I would have applied for one years ago. I'm not interested. You may do. Why do many people do charity work? Why do you give a quid to a homeless person? Because it's not because it's because you're trying to help that person, not because it makes you feel better. I'm going to let you hold this one in a minute. But what you must never do when you hold them is touch them. Dot, there's no need to be afraid. Dead easy. Frida's the brave one. Have you got cameras? Take the photograph. Isn't she just wonderful? And you see what Frida's doing? She's supporting her hand with the other hand. Look at her feet. She's got them spread. She knows I'm talking about her. No, sweetheart, not Doris. You mustn't touch her when she's on your hand. You ready? Now watch how she settles. See? You're not going to mess about the Tony. No, I'm talking to the bird. No, I'm not talking to you. No. Mustn't touch her. Remember, she's on your hand. That's okay. She's not going to hurt. Come on, chinky chop. She's not going to hurt you. That's it. I found that people have the right to see a bird of prey. They can't go to bird of prey centres in a care home or specialist unit, so what they can do is I bring the bird of prey centre to them in effect, but it's also a therapy. Put your hand up. Put your hand like that. Put that hand like that. There you go. That's how heavy she is. The reason she sits on my knee at home is because I need to have company. I'd rather be in the company of a bird of prey than I would with a person. My name's Colin Sutherland from Wings of Freedom, an organisation I founded to help people with dementia, special needs kids with mental difficulties, learning difficulties, bird of prey rescue and owl rescue. It's not falconry, it's a technique I use. And why do people fail on doing it? Because there's more to it than meets the eye. The people who work within Wings of Freedom, you may not see some of them, but they don't do it to be seen. Because otherwise what you'd be doing is you'd be doing something only for your ego, wouldn't you? There's enough egos around today without any more, isn't there?
Thank you so much to Colin there. Now, something that really struck us when we visited with Wings of Freedom was the resilience and care shown by the family members of those receiving care and treatment. And if you are interested in how to help family members go through difficult times, here are some of my tips on just that. So point number 1 is to make time for them. So make sure that there are no distractions, and please, especially your phone, and give the person the attention that they actually deserve. My second point is don't push them. It may have actually taken a lot for them to open up to you in the first place. So please be patient and don't push them too much. Let them tell you as much or as little as they want to. And they may not actually understand themselves what's going on, so it can be really hard to explain sometimes, and this could actually take a few conversations to really understand them. And I remember when I first opened up about my mental health issues to I think the first person was my mum actually, well, apart from my boyfriend who knew already. She didn't really know what to say or how to respond, and I didn't really understand what was going on with me, so it was kind of hard to express everything, and everything just came out in just like a lot of tears and panic, and it was a bit of a mess, to be honest. So if someone does actually muster up that courage to tell you what they're going through, understand that it could have taken years sometimes, or it could have taken quite a long time for them to speak to you in the first place. So don't expect it to just be, easy and for you to ask all the right questions. You just have to bear that in mind if someone does open up to you. The third point, very important, is don't interrupt, even if there seems to be long pauses, because if you think about it, that person is actually trying to, like I said earlier, trying to understand themselves what's going on, and they are maybe quite confused. So they may take these really long pauses and you think, okay, maybe I should say something now. But be patient, don't jump in and ask all sorts of things. Just give them that time. And if maybe, they're looking down and they're thinking, give them that time. If they then look up at you, then maybe ask them a question, but just be aware that sometimes it does take a long time to actually get the words out. The fourth point is, please do not belittle them. For example, if you say something like, oh, this is so silly, you're worrying about nothing. For you, it might be something very silly and very insignificant. For them, it might be a huge deal and something that actually is even making them feel suicidal. So never ever say anything like that makes them think, oh, well, you see, I shouldn't have said anything in the first place, because that could actually make the person go right back into their shell again. So be very, very careful. Never ever say that something is silly or insignificant, because to them it could be a massive deal. And then the fifth point is, of course, to help them to get the right help. In my case, my parents took me to the doctor first, and I was referred for counselling until I eventually found the right kind of help. So you decide which is the best form of help that you think. And also there are some organisations on our website, chrissybshow.tv, that you can check out. Well, everyone, I hope that's helped you, and if you have a story that you would like to share, or you'd like to give us your comments about this program or our past episodes, please do get in touch with you, because we really do love hearing from you. You can contact us on info@chrissybshow.tv. You can also tweet us at Chrissy B Show, or leave a message on our Facebook page, The Chrissy B Show. Until next time, bye-bye for now.